Now exercise for coordination. The first exercise is the jumping jacks. This is an explosive movement focusing on jumping up as far as possible. The subjects will be standing on a flat surface with your knees slightly bent. Squat down towards the ground and jump as high as you can. And extending your arms and legs out to the side like a jumping jack. Before you land, pull your arms and legs back together, landing with your feet just inside the shoulder widths. As you land, drop back into a squat position. Explosively leap back into the air for the next repetition, and there is no rest between the jumps. So repeat as many times as possible and aiming at least 8 repetitions. Repeat for 1 to 3 sets with 30 to 60 seconds rest in between. So jumping jacks are well-known cardiovascular exercise which will fit the beginner with poor coordination. It's also called side straddle hop in US military because it's a physical jumping exercise performed by jumping into a position with the legs spread wide and the hand touching overhead, and then returning to a position with the feet together and arms at the side. So this one will be once I am this sound. Next exercise we are going to demonstrate is the jump rope or skipping rope. It starts with the jump rope in each hand. Jump off the ground and start swinging the jump rope under your feet. Continue jumping up and down as you bring the jump rope under your feet. Continue for the prescribed number of jumps for time. So participants jump over a rope or rope swung so that it passes under their feet and over their head. Basic jumps were here. This is where the both feet are slightly apart and jump at the same time over the rope. Beginners should master this technique first before moving into more advanced techniques. Now there are alternate foot jump, that is speed step is there. This style consists of using alternate feet to the jump off the ground. This technique can be used to effectively double the number of skip per minute as compared to the above technique, as compared to the first technique. Now there are crisscross pattern is there. In this method is similar to the basic jump, with only difference being that while jumping, the left hand goes to the right part of the body and vice versa for right hand, and your arm crosses your body. There is another method is side swing. This is a basic technique where the rope passes side of the skipper's body without jumping it. Usually the skipper performs a basic jump after a side swing. Next exercise we are going to perform is the Scot thrust. That is, the subject should be in standing parade rest position and drop a Scot position with your hand on the ground near your feet. Throw your feet back, putting yourself into a push up position. Again pull the feet forward to a Scot position with the hand on the floor. Stand again in the parade position and repeat many times. So this is called Scot thrust. Next exercise we are going to perform is the box jump. So in order to perform the box jump, subject should be standing in front of a secured box or a platform, and subject will be jumping onto the box and immediately back down in the same position and immediately repeat. So this is called box jump. Okay. Next exercise we are going to perform is the squat and press with medicine ball. Holding a medicine ball at the chest level, squat down into a full squat and bring the ball towards your feet. As you stand up, press the ball up over your head and then return to the starting position. Repeat according to the prescribed repetition. So this exercise is called squat and press with medicine ball. Next exercise is the medicine ball pass with balance disc. The subject should be standing on a balance disc with a shoulder width stance. Then holding a medicine ball at the chest level, pass into another partner against a solid wall and return to the starting position and the repeat. Maintain your balance on the disc by keeping your core tight throughout the movement. So this exercise is called medicine ball chest pass with balanced disc. Okay. Next exercise we are going to perform is the single leg lateral hop. Start with the standing on one leg with your hand on your waist or at the sides. Proceeds to hop the side while maintaining your balance and hop back to the starting position. You can place a rope on the ground or any object on the ground. The object can be small in size or height or a large to increase the difficulty. Continuously repeat for recommended position. Next exercise we are going to perform is the high knee drills. Here the subject should be standing at the foot either on an agility ladder or even on the floor, and drive the knee up towards the chest and place the foot on the first square or back on the ground. Drive the other knee up and land in the next square, so on down the ladder in a moderate fast jog with a minimal ground contact time. This is called high knee drills. Next exercise is the burpees. From standing position, jump as high as possible and land down on your feet with your hand on the ground. Kick your feet back. For a moment you will be in a push-up position and jump back again as fast as possible and repeat the required repetition. This exercise is called burpees. Next exercise we are going to perform is the mountain climbers. That is, subject should start by getting on your hand with the feet on prone position. Then keep your body parallel to the ground. Drive your knees up towards your chest, alternating back and forth. Repeat this movement for the required number of seconds. This is called mountain climbers. Okay. In cycling, we have two phases, that is a power or propulsive phase, and the second one a recovery phase. Power phase means between the top dead center to the bottom dead center. That is from 360 degree, 0 or 360 degree to the 180 degree. That phase is called power phase or propulsive phase, where the maximum number of muscles, maximum number of energy and force is used. Second phase is the recovery phase. Recovery phase means it is from 180 degree, that is at the bottom dead center, to the top dead center, that is 360 or 0 degree, is called recovery phase. Now, at different positions, the movements of the position of the joint will be different. For example, if the seat height, and it depends upon the position of the limbs, the position of the joints also depends upon the seat height. Now at a normal seat height, that is at an optimum seat height, that is around 106 to 109% of the height of the ASIS. Now at that proper seat height, at an optimum seat height, the peak hip flexion is at 10 degree of pedaling cycle, and peak knee flexion is at 350 of the pedaling cycle. So maximum flexion, that is whether it is hip flexion, whether it is knee flexion, it is at around top dead center. That is, peak hip flexion is at 10 degree of pedaling cycle and peak knee flexion is at 350 degree of pedaling cycle. That is, flexion movements are seen at the top dead center. Once it reaches the bottom dead center, once the crank reaches bottom dead center, especially extension movement we can see. That is, peak hip extension is at 180 degree of the pedaling cycle and peak knee extension is at 170 degree of pedaling cycle. That is all thing at optimal seat height. So at seat height depends upon seat height also depends on the how much degree of flexion and extension joint movement is there in the during the cycling. Now, what is a comfortable seat height? What is an optimum seat height? It is around 106 to 109% of the pubic symphysis height is the optimal seat height. Now, peak knee extension. For example, if there is any change in the seat height, that is, if the seat height increasing or seat height decreases, so there will be changes in the flexion and extension. Consider if we are increasing the seat height. Now, the extension part increases. So, peak knee extension increases with increase in seat height, and P, that is greater degree of extension, that is again peak hip extension also increases with increase in seat height. So, as the seat height increases, extension movement increases. Now, if the seat height is bit low or if seat height decreases, there will be more flexion movement, like will be more hip flexion and more knee flexion at low seat height. So, as the seat height increases, extension increases, and as the seat height decreases, the flexion increases. Now, knee joint is the maximum affected joint due to the change in the seat height. Now, knee joint is the most affected joint with change in seat height. Now, once we go through the frontal plane analysis, the movements occur in frontal plane, that is medial and lateral movements, that is joint moves around 6 degree in medial and lateral directions. Joint center moves around 6 centimeter in medial lateral direction. That is in case of power phase, there will be at the power phase there will be femoral internal rotation and adduction movement is there. Power phase, the knee moves bit medially, that is internal rotation of the femur and adduction of the femur can be seen at the power phase, and knee moves medially. And along with that, there is pronation of the foot, and knee remains medial to the pedal center of pressure throughout the power phase. So, once we see the frontal plane analysis, during the power phase we can see the knee moves more medially. Now, we will go through which are the muscles acting on during the different movements of cycling. The greatest, we divided the phases into two. During the cycling we have divided, cycling phases can be divided into two, that is propulsive phase and a recovery phase. Propulsive phase is a phase where the maximum muscle activity is there. It is a phase between top dead center and bottom dead center, and here is the propulsive phase is the phase, or power phase is the phase where there is maximum number of muscle activity. And recovery phase, the muscle activity is very less. It is an unloading phase. So, once one leg is in propulsive phase, the other leg will be in recovery phase. So, opposite side limb will be in recovery phase between bottom dead center and top dead center, and substantially there will be less muscle activity is observed. So, it is an unloading phase, unloading of the pedal and minimizing resistance to the propulsive demand occurs in the recovery phase. So, more number of muscle activity seen at the propulsive phase and less number of muscle activity can be seen at the recovery phase. Now, which are the major muscles acting during the propulsive phase? The first muscle is the Gluteus Maximus. Everybody know that it is one of the hip extensor. It is the major hip extensor. Gluteus Maximus is the major hip extensor and its activity starts just after top dead center as extension of the hip starts. So, onset of Gluteus Maximus activity starts just after top dead center. Now, its maximum activity of Gluteus Maximus is at around 55 degree of crank rotation. Now, as it reaches around 90 degree, its activity, the EMG activity keeps on decreasing, and it stops around 90 degree of crank rotation. So gluteus maximus as hip extensor work here in the propulsive phase, in the early stages of propulsive phase, especially just after top dead center, and ceases around 90°, and peak activity can be seen at the 55° of crank rotation. Second muscle is the quadriceps muscle. Quadriceps muscle activity especially on the rectus femoris can act either both in the hip joint and the knee joint, and vastus and other muscles that is in the quadriceps group can work in the knee joint. Rectus femoris activity onset occurs before vastus and decline before the vastus group. Now EMG activity ceases shortly after 90° of the crank rotation, essentially ending the role as significant contributor to work. And during propulsive phase, power is imparted to the bicycle via forceful hip and knee extension. The next muscle primarily acting at the propulsive phase is the angle plantar flexus. So main work is the main activity of the angle plantar flexor is to keep the link between the pedal and the foot. So it keeps on during the propulsive phase. The angle plantar flexor work, and it makes a stable, that is provide a stable link between pedal and foot. So both muscles will act, that is soleus and gastrocnemius also act. Both soleus and gastrocnemius act just after top dead center along with the gluteus maximus and quadriceps. But soleus peak activity can be seen before 90° of the pedal cycle, that is the knee, at this point knee will be flexed, and gastrocnemius activity starts once the knee starts its extension, or once the knee starts its extension, because soleus is a single joint muscle and gastrocnemius is a two joint muscle, and with that is it is also crosses the knee. So soleus activity can be seen when once the knee is flexed, that is before 90° of the pedal cycle, and peak activity of gastrocnemius can be seen after 90° of the pedal cycle. Now activity of both soleus and gastrocnemius decline during the recovery phase. All the muscle activity decline during the recovery phase, and this muscle also, its activity also getting decline, and its activity ends around 270° of the crank rotation. Now next muscle is the angle dorsiflexus. Angle dorsiflexus are also active with the plantar flexors. This also enhances angle stability. The next muscle which works during this phase, propulsive phase, is the hamstring. All of us know that hamstring, it also helps especially in the hip extension. So here also hamstring help in the hip extension, and the both semimembranous, you know that there are three muscles in the hamstring. Among these three muscles, semimembranous and semitendinous are recruited just after top dead center, and peak activity slightly after 90° when the activity of the glute and vastus is almost nil. And continued activation of the hamstring can be seen for the entire power phase. These are the muscles we discussed. These are the muscles which act on the propulsive phases. Now we will discuss about the muscles which work in the recovery phase. Initially, that is initial phase of the recovery phase, that is 180 to 235°. Hamstrings and gastrocnemius actively provide a major component to flexion of the knee, because at this phase there is flexion of the knee. So there is hamstring and gastrocnemius work as an active component for the flexion of the knee. But in the late recovery phase, anterior tibial muscle dorsiflex the angle. It work along with the rectus femoris to flex the hip, and iliopsoas also active during the hip flexion. Now gracilis and sartorius will be active at the bottom dead center and ends till the its work goes till the top dead center. So gracilis and sartorius is another muscle which work throughout the recovery phase. Now tensor fascia lata activity starts at around 240°, and it goes till top dead center. Now we'll go through different injuries which occurs during the we'll go through different injuries which in the bicycle. Usually there are lots of acute injuries. The first and foremost, the common injury is the first type of injury which affect the skin. That is, usually there is chance of skin abrasion. It usually seen at the leg, arms and back. The next is the laceration. Laceration usually along with the once the leg or leg part rub with the chain. Then next is there is chance of contusion and of the hip and shoulder. Then another type of acute injury is fracture. Fracture usually occurs mainly due to the fall on outstretched hand or something. So usually there is chance of an olecranon fracture, clavicular fracture, fracture of the forearm and disruption of the acromioclavicular joint. So it's the second type of acute injury, that is fracture is another common type of injury, especially it occurs during bicycling due to a fall on outstretched hand. Now next type of injury is the concussion. Concussion is due to, actually it is exactly head injury itself. That is when the cyclist strikes his head during a fall. So it is suggested that, it is recommended that proper helmet he should take care of proper protective equipments and proper helmets. And we can divide the concussion into 3 stages. That is a mild, moderate and severe. And depends upon how much is the severity, the medical treatment has to be done. And mild is a few seconds, there may be a chance of, the mild means that there won't be any unconsciousness, and moderate type of concussion means there will be a very mild unconsciousness, and unconsciousness if he becomes conscious within 5 minutes, that is considered as a moderate concussion. And severe type of concussion means he will be unconscious more than 5 minutes. That will be considered as a severe concussion. So concussion, it may be a mild, moderate or severe, and the concussion is mainly due to the striking the head during a fall. So we always recommend that a proper helmet has to be worn during the cycling, that is cycling activities. And next thing is that athlete, once we are suspecting after an injury, we are suspecting that there is a chance of concussion. We suspecting that there is a concussion is there. He should not return to the activity until cleared by a physician. Otherwise, there is again chance of more injuries. Another type of injury which is commonly seen among the cyclists is the injuries to the eyes. That is, even it may be even a corneal abrasion. Next common type of injury is the quadriceps strain. Quadriceps strain, that is strain to the quadriceps muscle, especially seen a person who is doing the hill race. Then saddle race and boils may be there. Next common type of injury is the compression of the ulnar nerve at the Guen's canal. Next is carpal tunnel syndrome is another type of injury. That is this usually due to the hyperextension of the wrist. That is, cyclist has to keep his wrist in a hyperextended position for a longer period of time during the training and during the game. So he has to so this will keep hyperextension keeps the chance of carpal tunnel syndrome. Then there is chance of a compression of the radial digital nerve of the index finger. And there is chance of compression of the pudendal nerve, especially who are doing an upwardly sloping seat. Another common injury among the cyclists is an IT band friction syndrome. Usually the function of the IT band is, the work of the IT band is, it goes anteriorly once extension and it goes posteriorly during flexion. So this flexion, anterior and posterior, as it goes anterior and posterior movement during the knee flexion and extension, this IT band may rub with the epicondylae of the femur. And because of this friction, there is chance of inflammation. This is known as IT band friction syndrome. and cyclist has to do a lot of during the propulsive and recovery phase. He has to keep on to do a lot of flexion and extension of the knee, which will predispose to IT band friction syndrome. And the other predisposing factors are, if the person is having a tight IT band, there is more chance of an IT band friction syndrome, improper training, even once we are giving a high training load, because all these are type of overuse injury, and if we are giving a high training load, there is again more chance of injury. Again, another cause for the IT band, another predisposing factor for the IT band friction syndrome is the low seat height. We already discussed that what is happening. There is once there is an increased seat height or decreased seat height. If there is low seat height, there will be more flexion can be seen. So this again causes the rubbing of the IT band with the epicondylae, the epicondylae of the femur, and later leads to an IT band friction syndrome. Next type of injury is the infra-patellar tendinitis. It is also known as jumper's knee. It is especially seen those who are doing a lot of activities, weight training, because the player has to do, the cyclist has to do, along with the cycling, he has to do other training like other weight training, other running, etc. And along with this weight training and running, and he is doing the cycling activities also, it causes more micro trauma to the infra-patellar tendon, and later leads to an inflammation, and it is also called infra-patellar tendinitis and or jumper's knee. Next common injury seen among the cyclists is Achilles tendinitis. It is nothing but injury to the Achilles tendon, usually seen who does a very competitive, especially seen in competitive cyclists who does a sprint or a climbing or uphill cycling. Those who are doing, once he is doing uphill cycling, there will be more stress on the Achilles tendon, and later it may lead to a Achilles tendinitis. Now once again, a person who is doing the cycling on standing position, it again causes more stress on the Achilles tendon, and it causes stretching of the Achilles tendon, and later leads to Achilles tendinitis. And if the toe clips are too small, again it gives more pressure on this Achilles tendon and predisposes tendinitis. Another type of common injury seen, the common injury is seen among the athletes or cyclists is the lateral subluxation of the patella. That is usually seen among the cyclists, and the predisposing factors are the IT band. One predisposing factor is the IT band tightness, and another predisposing factors are the valgus. If there is more valgus, there will be more pressure on the lateral side, and if there is vastus medialis obliquus muscle weakness. Vastus medialis obliquus muscle is a muscle which pull the patella towards the medial side, and once there is weakness of the VMO, later it leads to it may cause a subluxation of patella. Now next is the shallow patellar groove, that is any biomechanical abnormalities. It may cause again the chance of subluxation of patella is there. Another cause for the lateral subluxation of patella is an overdevelopment of vastus lateralis. So there will be an equilibrium between vastus medialis and vastus lateralis. Either a weakness of the vastus medialis obliquus or an overdevelopment of the vastus lateralis. This causes more force will be produced, or more pull will be there from the lateral side, and this may predispose to lateral subluxation of the patella. Now the person has to do a lot of training, a lot of training and lot of exercises, and during all these cycling exercises he has to keep the neck in extended position, and once the person keeps his neck in extended position for long period of time, it may cause to the neck pain, and if the person who is doing the cycling for a longer period of time, again there is chance of lumbar pain and strain, even the sciatica. These are the common orthopedics problems seen. Other medical problems are a person who is doing a lot of training, especially he has to he has to do the cycling on the open environment over the sun. It may cause again hypoglycemia, hypovolemia and hyperthermia. These are the other common medical problems seen among the cyclists. So in this session, we discussed about the different muscles and movements, what are the top dead center and what is bottom dead center. We discussed about the different phases also, regarding the power phase, regarding the recovery phase also. That is, power phase means from top dead center to the bottom dead center, and recovery phase means from bottom dead center to the top dead center. And we also discussed about what is happening during once there is a changes in the seat height. That is, there is a recommended optimal seat height is there, that is around 106 to 109% of the pubic symphysis height. And if there is an increase in the seat height, what is happening, and if there is a decrease in the seat height, what is happening, this also we discussed in this session. And we discussed about which are the muscles acting especially among the propulsive and that is recovery phase. The propulsive phase, gluteus muscles act, quadriceps and angle plantar fluxus and dorsiflexus, hamstrings are the major muscles which act. Again the recovery phase, again almost all these muscle act, and hamstring, gastrocnemius, and again gracilis, sartorius and tensor fascia lata work. Then we discussed about the different injuries, different acute and overuse injuries during cycling. Thank you. Welcome back. In this session, we will be discussing about the warm-up and cool-down activities. This is one of the most familiar terms, two terms, warm-up and cool-down in the sports field. And most of the people is knowing about, will be having some idea about what is warm-up and what is cool-down activities. Now, warm-up these are some light exercise, light bouts of exercise, light exercises, which is usually given a high level of exercise. That is, a light forms of exercise usually given a high bout of activity. That is, usually if you are before a game, that is, there will be a high bout of activity, and before that you will do some light exercises. Or if you are going to do any training activity, before that you have to go for a light activity. This is called warm-up. This can be defined as a period or act of preparation of a game or performance or exercise session involving gentle exercise or practice. Now, usually it gradually raises the body temperature and heart rate. So, before doing any exercise, there should be a gradual rise in the temperature or heart rate will be effective. Usually, people do warm up for 3 reasons. The first, there are mainly three benefits of warm up. The first one is the prevention of injuries. Most of the researchers are saying that warm up decreases the chance of injuries, especially injuries like strains, sprains, delayed onset muscle soreness, etc. can be prevented by a proper warm-up. And it improves the performance. So, improvement of performance, prevention of injury, and it psychologically or mentally prepare the person for the event. So, these are the mainly warm-up. We used to do the warm-up before each session, so different sessions. So, usually prevention of injury, it decreases the chance of strains and sprains, and it decreases the chance of, researchers are saying that one of the major thing you can do to prevent the injuries and the delayed onset muscle soreness is warm up itself. Now, what are the changes occurring? What are the physiological changes occur during warm up? The first thing is that warm up, any exercise, warm up consists of lots of different types of exercise. All this increases body temperature. Now, it increases as it's also a part of exercise, as type of exercise. slow exercise, it increases oxygen exchange from blood to the tissues. Blood flow is redistributed to the working muscle from relatively inactive tissue. For example, in order to do some exercise, for example, you are going for a cricket practice or you are going for a football match, there are some muscles which will be active more. That muscle, the blood flow will be redistributed to that muscle which is actively active tissues, that active muscles. Now, heart rate and stroke volume will be increased, and metabolic and respiratory rate also will be increased. Now, physical efficiency improves. Now, the supply of synovial fluid to the joint is increased as there is increase in the temperature, and muscle fiber and connective tissue become more pliable by warm up. The increase in deep muscle temperature helps to decrease the internal friction. So, the contraction and relaxation of the muscle will be fast. So, this as the temperature of the deep muscle increases, the friction decreases, internal friction in the muscle decreases. So, contraction relaxation will be fast. So, it can be done in a greater speed. So, this speed is important, it improves the performance. Now, it prepares the neuromuscular system also. If the warm-up exercise is a specific exercise that comes, then it also prepares the neuromuscular system. The warm-up improves the psychological focus of performance. Now, which are the common components can be done in warm-up? The first one is we can incorporate the mobilization exercise to improve throughout that is range of motion exercises. Mobilization and range of motion exercises can be included, like small range of motion exercise to the different joints can be included in the warm-up. Next one is that light aerobic activity to raise the heart rate and body temperature. This we can include. Next one is statics, that is stretching exercise. The stretching which improves the flexibility, and stretching exercise which also prevent the injury and improve the performance. So, stretching exercise can be a component of the warm-up. And other activities which improves the heart rate and body temperature can be incorporated in the warm-up exercises. So, warm-up usually it should contain a range of motion exercise, a light aerobic activity to increase the heart rate and body temperature, and stretching activity can also be incorporated in the warm-up. But warm-up activity should be in low intensity. Movement should be progressive, that is from basic movements to more demanding movements. There should not be sudden burst or too many static muscular contraction. There should not be sudden static, there should not be a burst of muscle contraction. Now, use of major muscle group, avoid overuse of minor muscle group as this may cause fatigue. For example, warm-up is used to warming up the tissues and muscles. It should not cause fatigue. If it fatigue, it will affect the main, that is, it will affect the performance. And warm-up should be specific and appropriate. And in warm-up, there should not be any competitive activities. It is better to avoid competitive activities because competitive activities causes more use of energies, and it may cause fatigue or tiredness. Now, after doing warm-up, there should be a minimal time lag to start the main activity. Now, how much time we can go for warm-up? It depends upon the time of the day, intensity of the session, ability level, length of the session, environment, etc. So, there is no separate there is no separate written time for real set time for warm-up. So, these all factors influence. So, time of the day also influence, what is the ability and length of the session also influences how much time you have to go for warm up. So, the warm up is mainly, the purpose of the warm up is mainly for the prevention of injury, and researchers, lots of researchers have been done, and all this warm up, proper warm up decreases the chance of injury and it improves the performance, and it will give you a mental preparedness for the activity. Now, next activity along with the warm up, there is next another activity is cool down activity. Cool down activity, cool down is the term used to describe an easy full body exercise that allows the body to a slow transition form of exercise mode to a non-exercise mode. That is, while if you are doing a heavy training or if you are doing a match, so there will be heavy exercise, heavy training or heavy usage of body will be there. So, this has to be transferred to a non-exercise mode. This exercise mode to the non-exercise mode should be very slowly. So, these are the cooling down activities are the activities which helps the person for the slow transition of body from an exercise mode to a non-exercise mode. So, this cool down activities helps in the body to recovery and helps to disperse the lactic acid in order to reduce the next day stiffness or next day fatigue. So, it helps the body in the recovery, and this lactic acid helps to remove the lactic acid or disperse the lactic acid. So, the fatigue won't be there. So, almost all the exercise which can be used, which is used in the warm up can be incorporated in the cool down activities also, but depends upon the intensity. Cooling down can involve slow jog, walking, slow running, low intensity stretching, etc. can be used. So, these also can be incorporated in the cooling down activities. So, it is actually this is a stage where a transition stage be from a non-exercise mode to an exercise mode to a non-exercise mode. For example, if you are stopping your activity abruptly, it may cause the pooling of the blood. It may cause venous pooling. So, this may cause pooling of the blood, and so once the blood is getting pooled, the waste product of athletic activity, especially the lactate, after there will maybe waste product lactate will be there in the blood. This has to be removed. If the blood is getting pooling down, or veins are getting pulled down, or the blood is getting pulled down, and this removal of the waste product won't be there. So, this may cause fatigue, muscle soreness and cramps. So, this slow activity helps the person to remove the blood from, that is to avoid the pooling of the blood and avoid the pooling of the that will help for the removal of waste product of the activity. Now, cool down activity gradually decreases the body temperature, heart rate, speed of recovery process before next training session. So, in order to return to the pulse of its resting rate, a similar activity could be used as one of the warm up. Now, what are the benefits of cool down activities? The first one is it aids in dissipation of the waste product, including lactic acid. So, next is it allows the muscle to return to the normal temperature slowly and reduce the risk of damage due to sudden drop in temperature. So, I told you it is a transition mode from high intensity activity to a non-exercise level. So, this has to be slow, and it decreases the chance of delayed onset muscle soreness. So, delayed onset muscle soreness, there is risk of decreased risk of muscle soreness will be there in those who are doing cool down activities. It decreases the chance of dizziness and fatigue by pooling venous blood at the extremities. I told you, we already discussed that it causes the blood flow easily. Blood flow will be it decreases the pooling of the chance of venous pooling, and venous pooling in the extremities and it decreases the chance of pulling, and the waste products will be removed. It decreases the level of adrenaline in blood, and it allows the heart rate to return to this resting stage, and it helps the body to return its normal state as quickly as possible. So, in this session we discussed about the warm up activities. What is warm up and what are its benefits of warm up? What are the physiological changes occurs during warm up? Then we discussed about what are the different components which can be incorporated in the warm up, like example like mobility exercise, aerobic activities, light aerobic activities, stretching exercise, and the activity which increases the heart rate, etc. Then we discussed about the which are the components of the warm up, which are the exercise can be incorporated with the warm up, and how much duration the warm up can be done. There is no real set time for the warm up, depends upon the time of the day, environment, and how much the session intensity of the session, how much is the ability level, and how much is the length of the session, etc. Then we discussed about the cool down activities. What is meant by cool down activities? It is a slow transition exercise. It is an exercise which used to help from an exercise mode to a non-exercise mode, and its benefit also we already discussed. It is main effect is it removes the waste products, along with that decreases the chance of DOMS and the muscle soreness, etc. Thank you. Welcome back. In this session, we will be discussing about the muscle cramps. Muscles cramp is an involuntary and forcefully contracted muscles that cannot relax. It is an unpleasant, often painful sensation caused by muscle contraction or over shortening of the muscle. So, usually a muscle contraction causes an visible or palpable hardening of the involved muscle. Now, what are the causes of muscle contraction? The first cause is an overuse of the muscle, or straining, an overstraining or an overuse of the muscle cause the muscle cramp. Then second common cause is a lack of minerals, that is in the diet, or depletion of minerals in the body. The third cause is hypoxia. Then another cause is dehydration and low blood salt. Muscle cramp also seen as a complications of pregnancy and kidney diseases, thyroid disease, hypokalemia, then hypocalcemia, restless leg syndrome, varicose vein, and multiple sclerosis. So, the causes of muscle cramps may be a overuse of the muscle, lack of minerals or in the diet, or depletion of the minerals in the body, hypoxia, dehydration, low blood salt, and it may be a complication of pregnancy, or it may be a complication of certain diseases like thyroid disease, kidney disease, or hypocalcemia, or resting leg syndrome, varicose vein, multiple sclerosis, etc. Now, pathophysiology of the cramp. Usually, the muscle work as antagonistic pairs, that is, usually the agonist and antagonist work together. Now, the contraction of the skeletal muscle requires relaxation of opposite muscle of that pair. That is, one muscle, we can say that is one muscle goes for a concentric contraction, at the same time the opposite muscle goes into an eccentric contraction, that is, we can say here it is as a relaxation. Now, cramps can occur when the muscles are unable to relax properly due to the myosin fibers are not fully detaching from the actin filaments. Usually, in case of a concentric contraction, the actin and myosin fibers comes together, and at the same time the opposite muscle, the eccentric muscle, here the actin and myosin fibers detaches, and there will be an eccentric type of contraction or relaxation of the muscle. So, in case of cramps, the relaxation property that is the relaxation property, that is the detachment of the actin and myosin fibers does not occurs completely, and this is the cause of the cramp. And in the skeletal muscle, both ATP and magnesium must attach to the myosin fibers in order for them to dissociate from the muscle and allow relaxation. And the absence of either of these sufficient quantities means that the myosin remain attached to the actin. That is, usually energy, the magnesium and ATP is important for this relaxation, and this has to be attached to the muscle fibers for the dissociation, and it allows the relaxation. And either magnesium or there is a decrease in the ATP level, it causes in an insufficient quantity of ATP level or magnesium causes a chance of relaxation property will be decreasing, and it causes muscle cramp. Now, there are three types of cramps commonly seen. The first one is true cramp, that is usually commonly seen in the skeletal muscle. Next one is the smooth muscle cramp, and the third one is nocturnal cramp. We can call it as rest cramps. True cramps, it's commonly seen at the skeletal muscle. It may be a single muscle or a group of muscles is usually involved, and caused by hyper excitability of the nerves that stimulate the muscles, and usually occurs in injuries and muscles activity which causing fatigue, and in case of low calcium level, low magnesium level or low potassium level. So, the true cramps usually affect a muscle or a group of muscle which act together, and it is caused by the hyper excitability, that is especially due to an overuse, and in case of injury or muscle activity which causing fatigue. In this also seen in once there is a decreased level of sodium or decreased level of calcium, magnesium and potassium in the blood. Rest cramps are usually an involuntary muscle contraction. Usually it is seen in rest, usually affect in the calves, soles, feet, etc. And usually seen at the usually affected muscle is the calf muscles, gastrocnemius and plantaris muscles, and it also affect in the feet also. Now, the most commonly seen among the older people. Now, the most common cause is the dehydration itself and low level of the mineral content like magnesium, potassium, calcium and sodium, and reduced blood flow through the muscles, and for in case of prolonged sitting and lying down. So, these are the causes of the rest cramp. Rest cramp commonly affect the calf muscles, and mostly commonly seen among the older peoples, and there is the causes are again the dehydration, low levels of certain minerals like magnesium, potassium, calcium, sodium, etc. Now, smooth muscles also like skeletal muscle, smooth muscle also may get cramped. Smooth muscles contraction at the treatment may be symptomatic, endometriosis or other health problem. Menstrual cramps also can be seen among the peoples usually in females with menstrual cycles. Now, what are the treatment for cramps? The first and important treatment is stretching, that is the structure has to be stretched for a longer period of time. The massage, that electrolyte, there will be decreased electrolyte, there will be an electrolyte imbalance may be there. So, a proper electrolyte supplementation will help. A proper electrolyte supplementation will help to decrease the cramp. Then vitamin B and a lidocaine or a calcium channel blockers can be used as a treatment for this for the cramps. Now, prevention of the cramps is, the first thing is proper warm up and cool down before the activities, proper stretching techniques, proper hydration and electrolyte supplementation, and avoid excessive fatigue. So, the prevention of the cramp is done by the first one is there should be proper warm up and cool down. You know what is warm, everybody will be knowing what is warm up. That is, these are the exercises we already discussed it. These are the exercises given just before the activity, and cool down is done after the activity. So there should be proper warm up and cool down activity should be there, proper stretching, the muscle should be having proper flexibility, so proper stretching program has to be there. Then proper hydration and electrolyte supplementation should be there, that is the proper water intake should be there, proper and electrolytes like calcium, magnesium, potassium should be supplemented properly, and avoid excessive fatigue. These are the prevention. Now we discussed about the muscle cramps. What are the causes of the muscle cramps? What is muscle cramp? What are the causes? And regarding the pathophysiology, then we discussed about the types of cramps. What are the true cramps? What is smooth muscle cramps? What is rest cramps? True cramps are commonly seen at the skeletal muscle. These are also called skeletal muscle cramps. Rest cramps usually seen at the calf muscles, and it is mainly due to the contributing factors are the dehydration and low levels of certain minerals like magnesium, potassium, calcium, sodium, and reduced blood flow through the muscles in a prolonged sitting or lying down. Smooth muscles are also getting cramped. The treatment includes stretching, massage, electrolyte, vitamin B supplementation, lidocaine and calcium channel blockers. Prevention is done by proper warm up, stretching, proper hydration and electrolyte supplementation. Avoid excessive fatigue. Thank you.